The biggest decision that you need to make when you start Medicare is, do you stay with original Medicare or do you go into a Medicare Advantage plan? Most people are completely unprepared to make this decision. They don't understand the differences between the two, and they are drastic between the two. The differences are like night and day. We need to understand completely how they both work so that we can make the best decision for what we want to do with our health insurance, really for the rest of our lives. So I'm gonna go through that right now. I'm gonna try and keep it super easy, super simple to understand the difference between staying with original Medicare or choosing a Medicare Advantage plan. And I'm Keith Armbrecht. I'm founder of Medicare on Video. I help people across the country make the right Medicare choices. We kind of do all the work for you. There's no cost to allow us to do that for you. So hopefully you'll let us help you with your Medicare. But I'm gonna go through right now the difference between staying with original Medicare or choosing to go into a Medicare Advantage plan. The first thing to understand in either case is you need to sign up for regular Medicare, original Medicare, Part A and Part B. You have to sign up for both of them. Part A is stuff that covers things in the hospital. Part B is stuff that covers things outside of the hospital. But they're broken down into different pieces for whatever reason they've done that, but you need to do that. Part B has a premium. Right now, it's $185 a month, and you're going to pay that premium whether you stay in original Medicare or whether you go into a Medicare Advantage plan. A lot of people think if you choose Medicare Advantage, you don't have that premium any longer, but you will continue to have that premium regardless of which plan you take, and that is the baseline premium. Medicare Part B premium is income adjusted. I have a video on exactly how that works. If you make above a certain income, you're going to pay more than that $185. Could go up all the way to $600 a month. So it can be a drastic increase in that Medicare Part B premium, but that's a different video. You can certainly watch that. It's called IRMA. It's income related monthly adjustment amount, and it can surprise a lot of people when you come into Medicare. So make sure you take a look at that. But Part B premium is going to be paid in any case when you come into Medicare. So now that we've signed up for Medicare Part A and Part B, this is where our big decision comes into play. We need to either choose to stay with original Medicare or go into a Medicare Advantage plan. I'm gonna break them down pretty easily on understanding exactly how they work. Let's first talk about Medicare Advantage. So Medicare Advantage, I'm just not a fan of. It works for a lot of people. About half the people are on Medicare Advantage right now and half the people are in original Medicare. But to me, you just give too much away when you go into a Medicare Advantage plan. So a Medicare Advantage plan is actually not Medicare. It is run by a private insurance company, so it can be very similar to a plan that you may have had at work recently, where you have a managed care type plan. It could be a low-level HMO, it could be a higher level PPO, and there's some differences there, but some of them make it sound better than it is, and especially on a PPO plan. So when we're talking about managed care and Medicare Advantage, generally there's going to be a network of doctors that you have to use, a network of hospitals that you have to use. And certainly if your doctor and your hospital are in this network, that might work out just perfectly. But a lot of times they aren't. And a lot of times it can be very difficult to find the doctor that you want in the network that you have to use. So that's certainly one of the drawbacks to Medicare Advantage, is the restrictive nature of providers and trying to find the right provider. And then when you do get into the right provider, many times they leave the plan. The hospital can actually leave the plan. It can be very disruptive going into the middle of some kind of medical situation. That's certainly one reason why I would certainly choose to stay with original Medicare. Now, also on Medicare Advantage plans, they have other restrictive type scenarios, such as pre-authorizations. And that's one of the biggest complaints with a Medicare Advantage plan is pre-authorizations. You may have heard about it recently because it's been making the news a little more now than it has been, where when you go to your doctor and your doctor says you need to have this done, but then follows that with, but wait, we have to get it approved by the insurance company first. So that, again, is something that I would not want to have in the middle of care that I need right now, is to have to put the brakes on and get something approved by the insurance company. And it very well may be approved, but it also very well may not be approved. I just did a video recently on how many pre-authorizations there have been, somewhere around 50 million in a year. That's just a ridiculous amount, where they're just saying, stop, we're gonna slow things down and maybe you won't continue to spend the money to have it done. Again, not something I want the control with my healthcare. So that's a big obstacle with a Medicare Advantage plan. Obviously, honestly, I'm not a fan of Medicare Advantage. I'm a little biased here, but I'm trying to give these straight up facts on why I'm biased. Another one is referrals. You've likely had this in the past where if you need to go see a specialist, a cardiologist, gastroenterologist, whatever it may be, first you have to go to a primary and get them to give you the okay and give you a referral to go to that specialist. Again, adds maybe months onto that appointment to get to where you need to go. And again, not something that I want to have to do if I'm not feeling well and I want to get better. So those are some of the bigger restrictions within Medicare Advantage. There are certainly many more. You can Google Medicare Advantage complaints and you'll see all sorts of horror type stories, but that's the reason that I'm biased against Medicare Advantage. I want control over what I want to do with my healthcare. So with original Medicare, A and B, they do have some out-of-pocket costs. So B has a small deductible, A has a big deductible, B only covers 80% after the deductible. So there are some out-of-pocket costs. So in that case, we want a Medicare supplement plan, a Medigap plan that fills in those gaps, that covers the stuff that A and B do not. And there's really good choices for that. But staying within original Medicare, you can go to any doctor, any hospital, anywhere in the country without having to ask for permission. You can go to a specialist without having to ask for permission. You can get whatever is medically necessary done without having to ask for permission. So you don't need a referral, you don't need pre-authorization, and you don't need to stay within a network of doctors and hospitals. And that is exactly the way health insurance should work. It may be more costly to the insurer, which is Medicare, but it certainly works in your favor for doing what it is you need to get done. And God forbid something significant comes along. And obviously as we get older, things do, cancer, blood situations, whatever it may be, we just don't want roadblocks and speed bumps and things in our way to get done what we need to get done. So with original Medicare, it's just super easy. And this is what I've done for a very long time. I help with that Medicare supplement plan. We find the best value in your zip code. We're licensed in all 50 states, so we can help anybody anywhere in the country. And I've helped more than 10,000 people, and I don't get any complaints. I don't get any angry phone calls with things that aren't going the way they're supposed to go. If I did do Medicare Advantage, I would have those calls all the time. I would have to have a whole customer service department to fix things that go wrong and to fight for things that should be covered that aren't being covered, and I just don't want anything to do with that. So Medicare Original with a supplement plan, you're happy, your doctor's happy, the hospital's happy, they get paid what they're supposed to get paid, they don't have to fight for their compensation, and it just works the way it's supposed to work. Now, from a cost standpoint, Medicare Advantage can be a little more affordable on the front end, but it can be more costly on the back end when you use it. So it kind of evens itself out. On a Medicare supplement plan, the premium can be it can be anywhere from between $80 and $120 a month for a Medicare supplement plan, whether it's Plan G, Plan N, whatever it may be. It's not really cost prohibitive, but when you use it, it's very little out-of-pocket expense. If you had a Plan G, your only out-of-pocket expense for the year would be the Part B deductible, which right now is about $250 a year. And that's it. On a Medicare Advantage plan, you face much higher costs when you use it, and it can have an out-of-pocket maximum where that Plan G is $250. On a Medicare Advantage plan, it could go all the way up to about $9,500. So it can be a significant financial burden when you use it. So much more restrictive on Medicare Advantage, much more costly when you use it on Medicare Advantage. Medicare Original, it's easy. And I tell people when we set it up, this is really going to be the last time you think about your health insurance. You go to your doctor, you give them your card, your Medicare card, your supplement card, and that's it. The doctor gets everything paid through Medicare. They don't even deal with the insurance company to get reimbursed. Medicare handles it all. So that gives you a pretty decent idea on the differences between the two. And again, I'm biased, absolutely, 100%. I would not have my mother on Medicare Advantage. I won't be on Medicare Advantage. I'll do whatever I can to stay with original Medicare with a supplement plan. We'd be happy to help you with that. Fill out the form on my website. We'll send you a quote on a Medicare supplement plan that shows you the best value in your area. Give us a phone call. We can walk you right through it. We'll just make sure everything gets put in the right place. And literally, you won't have any thoughts about health insurance down the road. So I hope you found this helpful. Have a fantastic day.